I'm dispatched to a patient for chest pain. I arrive on scene, I determine the scene is safe, I have my BSI, my gloves on. I identify the number of patients as 1, and I will consider additional resources such as ALS. Walk up to the patient, perform my general impression. He's a male, about his mid-30s, mid-50s for our purposes. And he's obviously in some discomfort, so I'm going to start my assessment. Sir, how are you doing today?
Chest.
Your chest? Does it hurt?
Yes.
Or? Okay, I'm going to ask you a few questions, okay? Can you tell me what day it is?
September 24th.
And can you tell me where you are?
South.
And can you tell me who the president is?
George W. Bush.
Okay. By doing that, I have established that his airway is patent. He has a pulse by establishing radial pulses. He is breathing adequately and his airway is open and clear. Now what I'm going to do is, if I had it, I would give him oxygen, but I don't have it right now, so I'm just going to give him the oxygen, sir. Here's some oxygen for you. He puts on the oxygen. It's 15 liters by non-rebreather. So I'm going to ask you a few more questions, okay? At this point, I establish sample and OPQRST. Know what they are. Sir, can you tell me what exactly you're feeling?
I have severe pain in my chest, radiating up to my chin and out my left lung.
Okay, it goes and moves. Alright. And can you tell me what allergies you have?
Penicillin.
Penicillin? Can you tell me what meds you're on?
I'm on Coumadin, nitroglycerin, and Lipitor.
Okay. And can you tell me, when was the last time you had anything to eat?
Lunch.
And can you tell me, what's your medical history? Has anything happened to you within the past year or so?
Last year I had a heart attack. And 2 years before that, I had a little angioplasty.
Okay. Did they do anything for your heart attack, or? And you said you have allergic to penicillin,
Yes.
and your meds are Coumadin, Lipitor, and Nitro.
The only reason.
So what led up to you to your chest pain?
I was just gardening.
You were gardening? Okay. I've established sample. Now I will establish OPQRST. Sir, how was this onset? Was it sudden or was it gradual?
Sudden.
Was it sudden? Okay. And anything make it better or worse? Nothing makes it better or worse. Okay. What's the quality? What does it feel like? It's crushing. Okay. Does it move anywhere? It goes in your left arm and your chin. Okay. Okay. Because I noticed you said that earlier. And what's the severity of it? How bad is your pain on a scale of 1 to 10? 10 being the worst pain you've ever felt in your life. To 10? Okay. And how long ago approximately did this occur? It occurred about an hour ago. So now I've established OPQRST. Now that I've done that, I will proceed with taking a set of vitals, starting with blood pressure. Do you have a preferred arm for blood pressure? Can you roll up your sleeve? At this point with vitals, I am taking a set of vitals to establish, if he's stable, if he's a stable patient, if he's an unstable patient, things like that. Okay. Up here. Anything wrong with that? Same here. Okay. I'm going to leave the blood pressure on because I have to take a second set of vitals. So I'm just going to take the pulse, put my arm up. I will have done this for 30 seconds to count both his respirations and his... Okay, now I'm going to establish, sir, can you take a deep breath for me? Again? Okay. You'll listen to his breath sounds to see, if he's breathing right, if he has any breathing problems. Take a deep breath for me. And hold. And again. Again. One more. Another one. Okay, I've established 6 breath sounds normally. Sometimes people do 10, 4 in the back. I do 6 usually. Now I've taken his vitals, which I will record. Now I've recorded his vitals, I'm ready to give him his medication. Sir, you said you had nitroglycerin. Do you have it with you?
Yes, I do.
And that's the bottle. Now that I have a bottle, which I don't obviously have, but I would have it, I'm going to check the 5 R's. Right med, right dose, right route, right patient, right expiration date. That's 5, right? So I'm ready to give him his meds. So I want you to take 1 tablet of this. I want you to put it under your tongue. I want you to keep it there. Do not chew, do not swallow it. And here you go. He takes the 1 tablet, he puts it under his tongue. And what I've just given him is I've given him nitroglycerin. Nitroglycerin is a drug used for chest pain. It dilates your blood vessels, blood flows more freely. Now if that has happened, I would take a second set of vital signs. I'll do a detailed physical examination. We'll check the neck for trachea, deviation, stoma, JVD, and medical alert tags, and I find none. I'll recheck clavicles, sir. Can you take another deep breath? Again. Lean back a little bit. Palpate the abdomen for tenderness, rebound tenderness, rigidity, distension. Check the legs for edema. Can you lift your feet up? Can you push down my hands? Can you push up? Can you feel this? Okay, I've assessed PMS, post-motor sensory, lower extremities. Can you squeeze my fingers? Are you touching him? Okay. He also has, PMS in his arms. We'll also assess pulses. He has strong radial pulses. This one I will reassess the patient's condition. Sir, are you feeling any better now?
Yes.
Feeling any better? How is your pain now? On a scale of 1 to 10?
5.
It's about a 5? Okay. Now I've established this, I will transport my patient to the appropriate medical facility, and I will give a medical command report to that receiving facility.